As cases of Omicron surge across the country, hospitals are seeing their resources pushed to the max. For example, in Ontario, the William Osler Health System has declared a code orange. Now, it oversees the operations of Brampton Civic Hospital and Etobicoke General Hospital. For more on this, our Chase team has reached Dr. Andrew Healy. He is Corporate Chief of Emergency Medicine at William Osler Health System. He's also an emergency and critical care physician. Dr. Healy, what was it that pushed you to declare this code orange?
So, Suhana, we're seeing levels of illness within our healthcare workforce higher than we've ever seen at this stage in the pandemic, and that's markedly affecting our ability to staff various units, including the emergency departments across our sites. And so we were pushed to a level that we had not been pushed to prior to this in the pandemic. And so as a result of that, we made the difficult decision to use the Code Orange call to really communicate the gravity of the situation that our healthcare system is facing. And
you know, Dr. Healy, we've been in this for 20-odd months or so. Is this the first time you've declared a Code Orange in the pandemic?
It is the first time we've declared the Code Orange, although we've seen, a large number of COVID-19 pneumonia patients come through our front doors. As you are undoubtedly aware, the Greater Toronto Area IMS table assisted by moving hundreds of patients out of our health system in waves 2, 3, and we're just not seeing the patient level of high acuity illness that we were seeing at that time. But we are seeing the illness impact our ability to deliver care in a way that we have not seen thus far. And to be clear, we're only marginally worse than our colleagues. And we decided to call the Code Orange, but I'm aware of many hospitals who are stretched as close to as thin as we are.
So can you walk into the emergency offices there, into the emergency room?
You absolutely can. And I mean, we want people who are sick to come to see us, and our ability to deliver that emergency care is still present. And our hospital is still a place to come if you are ill. We're asking people who are mildly ill to avoid the emergency departments and seek care at their family doctor, even if that care is virtual initially, to help triage whether or not they need to be seen at an emergency department. We're asking people with mild symptoms of COVID-19 for sure to stay home. But if you have chest pain or shortness of breath or serious abdominal pain, you need to come to an emergency department. The emergency departments in Canada are really the safety net that exists within our healthcare system. Our staffing levels are pushed to extreme levels at the moment. And so we're asking for people to be patient as they wait for that care. But our staff has a generosity of spirit and a real commitment and laser focus on providing patient care. And in many ways, the Code Orange helps everyone identify that the single priority is running the health system. It is active patient care, and everything else needs to be deferred for the period of time in which we're facing this surge.
So what then has to be deferred?
All of the non-clinical focused activities that run a hospital are being pushed to the side for the moment. All of our clinics are moving to virtual where they can. Everyone, as you are aware, in Ontario has been ordered to reduce their elective and procedures to as low as they possibly can. And we are attempting to really focus on the care of acutely ill patients through our front doors.
You're keeping an eye on other hospitals. I'm sure you guys, you have colleagues who work elsewhere. You talk. You're in Code Orange. What are you expecting in the days ahead?
I think even beyond, it can't be understated the effectiveness of the COVID Critical Care Command Center and the GTA IMS command table. Those are formal structures that are unprecedented in healthcare in Canada, and they allow the integration of those hospital systems and risk. And when we reached levels 2 days ago, we actually saw our colleagues who are marginally, only marginally better than us, accept 1 or 2 patients from us in transfer. I don't think that's a sustainable strategy in the future, and I think that We were able to vet that William Osler Health System is worse than others by a very small margin, and that's a very dynamic situation. I think every hospital system is facing a health human resources crisis where hundreds of staff are infected with COVID-19 or have high-risk exposures, and so we are attempting in every possible way to bring people back to work when we can. To help care for patients and to ensure that patient care is available when you need it.
Final question for you, Dr. Healy. Obviously, the focus is on patients, but you talk about human resources. Let's talk about the word human in that. How is it for the people who are providing the resources, for your staff, for your nurses, your doctors? They're at home sick. They have to stay and take care of themselves and their family, but I'm sure their hearts are in the emergency department or other units of the hospital. What's it like in there for them, for you?
Thank you for asking. I think we are seeing burnout and exhaustion in ways that we haven't seen before. I know it almost seems routine for you to hear that, but really we are at a point in our healthcare system where it's phenomenal to me to see that the nurses on the front line continue to show up in these very difficult conditions. I mean, they truly do have courage and generosity of spirit that goes beyond what we expect from the human condition. It's phenomenal to me that people are able to come to work and still able to work as a team and do so in a coordinated and expert manner in every hospital across this country who is affected by this pandemic in ways that are deep, emotional, personal, professional. Their team members are ill, their families are ill, their children are now home from school. People are amazingly resilient, but there comes a limit for everyone, and I think that is part of our absenteeism problem at the moment in terms of people calling in sick. And I think burnout is as important an illness to see at the moment as COVID-19 for our healthcare workers. So what we really need from patients and family are a real empathy for that workforce that's there, the conditions that they're working under, and the stress that they're enduring, both in their personal and in their professional lives.
I certainly wish you a happy new year and health in this new year. You take care of yourself, okay?
Thanks for having me, Stuhana.
Dr. Andrew Healy, Corporate Chief of Emergency Medicine at Osler Health.